The content shared here is for informational and educational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Today, I'm speaking with Dr. Carolyn Larkin Taylor. Dr. Taylor was one of the first women to graduate from the University of Notre Dame. After graduating from medical school, she completed her neurology residency at the University of Pennsylvania, where she was awarded the Humaneness in Medicine Award and named one of Philadelphia Magazine's top doctors for women. She's been practicing medicine and advocating for patients for more than 30 years. Today, she's here to talk about her book, Whispers of the Mind, a Neurologist's Memoir. Dr. Taylor, welcome, and thank you so much for being here today.
Thank you so much. It's really an honor to be here and be able to talk about my book.
Well, to start us off, could you tell us just a little bit more about yourself and what it was that made you write Whispers of the Mind?
Sure, I'd be happy to. I've had a fairly varied career as a general neurologist. I started out in the Philadelphia area. I'm from the East Coast originally. I grew up in a little town called Spring Lake, New Jersey. And when I went to professional school, I went in the Philadelphia area after I completed my college training in University of Notre Dame. Of course, that's in the Midwest. I love the University of Notre Dame, but I'm not um, someone that wanted to live in the Midwest, having grown up by the water all my life. So I went to school in Philadelphia, and then I remained there practicing for about 10 years. And as a family, my husband and I decided with our son we wanted to live out west. So we took off for the Pacific Northwest, a place I'd always wanted to see and romanticized about. And we live very close to the water out here as well. So it's been a wonderful move, and I've loved it out here. And I practiced general neurology in the area that I live in now, which is north of Seattle. And I opened up a MS center because a large part of my practice was actually patients that suffering from MS. Over time, I eventually went to Seattle and joined a hospital practice. And so I've had a very varied experience with neurology. I did retire from full-time clinical practice about, I guess it's 2 years from now, 2 years ago. And I've been working with veterans since part-time, evaluating patients with traumatic brain injury. And I love taking care of veterans. So it's been a real joy for me to do that. But when I finished the clinical practice part of the intense clinical practice part of my life after more than 30 years, I felt I just had more time on my hands. So my entire clinical life, I journaled. That was my way of dealing with of processing information. That was my therapist, so to speak. And so I could sleep at night when I had a difficult patient encounter, something sad would happen, or I was really struggling with, the death of a patient or some tragedy I'd seen in the hospital. I would come home and I would write about it. And first I wrote longhand, and that was before we had computers, actually. I finished my training in 1993, and computers were just kind of coming out then. Um, and then I started just putting them on computer. And I could take that information, write it down. It would help me intellectually process it. And I kind of took it out of me, and then I put it on paper so I could compartmentalize it and get some sleep and then go on and move on to the next case, because you have to. You can't just fall apart when something sad happens, or you get attached to a patient and their family and they die and you can't move on. You have to move on. That's what we're trained to do. So that was my way of processing all of it. And when I had more time on my hands, I sat down and for the very first time, and I started reading through my journaling. And I was really surprised being on the other side of it now, as a mature physician whose most of her career was behind her, looking at how I dealt with various situations and how much they taught me. My patients were my teachers, and they taught me so much about the human spirit, about courage, about resilience. And I was inspired all over again. And I wanted to share that inspiration with other people because there's a lot to learn from some of these brave individuals. And at the end of the day, when you read about a real life medical story, I think you can connect better with that history, that patient, that disease, and the universal themes of addiction and death with dignity and gaslighting and all the other things that come up in this book. I think when it's a real life story, it's a real life stories that stay with us and teach us. And I just decided that's what I wanted to share. And that's what I hope my readers come away from this story, these stories that I wrote about, with that sense of hope and courage and a little more empathy. Um, I try to use a lot of visual imagery in my book, and the stories were chosen more emotionally than, well, I want to illustrate this point or that point. They were stories that were emotionally um, attractive to me in some way that I thought I could convey that best to my patient with strong visual imagery. I wanted the patient to be able to feel like they were in my pocket going around with me, seeing all these patients and doing the things that I was doing.
Well, it definitely shows in your stories. I felt the emotion throughout the book and I loved it. I loved reading it. Can't recommend it enough.
Yeah, thank you so much. Thank you. There's still a couple of stories I can read, or I've read in a book signing, for instance, that can make me start to cry. So they're a lot of them are emotional. I tried to put in, they're individual. You could take this book and you could read one or two essays. You could pick something that you think is interesting to you. um, the parent dealing with a child who's an athlete that develops a concussion, or medical gaslighting, or someone that is trying to um, get approved for assisted suicide because of a devastating neurologic condition. And you could just pick and choose what one you think would be interesting, what appeals to you. And each story stands out on its own. But the way the stories are structured is I started with stories in my medical school training and then on to internship and residency and then throughout practice. So there is an evolution. It's a memoir, so to speak, because it's how I felt about what I was going through, what I was learning from the patients. And I included some stories in my own life in there that were had to do actually with neurology. 3 incidences of death in my own family that from neurologic illness that I had to deal with as a family member and a physician. And I also have some information in there about what it's like to try to combine motherhood and a career. And so that's a very good essay for anybody, any woman in medical school or thinking about going to medical school, or in medical school and thinking about becoming a neurologist. That it gives you a little bit of insight to what it's like to be an intern and have a little baby at home that you miss, and how to handle those feelings. So in the end, it's positive. I would recommend wholeheartedly anybody wanting to do both that you can do both. You'll always feel like you're not doing either one of them as well as you want to. But if your heart is in it and you have help, I had help. I had a wonderful, caring husband and father to my son. That was of enormous help to me. And with all that help and love that I was surrounded with, I would have to say anything's possible.
That's great advice for young moms wanting to become a doctor.
Yes, and I think there's more and more of that. My own mother discouraged me when I told her I wanted to be a physician because her father was a physician. And she said, it's a very hard life. You may miss out on a lot of things, um, that a lot of special events. I know my father wasn't there when I graduated from boarding school, and he wasn't there this event and that event. He missed birthdays. And do you want to do that? Maybe you want to consider family first and go into a career that'll allow you to do that a little bit more. And I thought, oh no, she doesn't really know what she's talking about. I can do anything. Well, I thought I could do anything, but she was really right. You do miss a lot. there are times you can structure your life. And I think women today can do it so much easier than I could. When I did my medical training, it was still the old boys club that, you had to be there and you couldn't miss a day. And so what if your kid is in a parade today? You're a resident and you better be here. And otherwise you're dumping on the rest of the residents to pick up your slack. And I did all those things. Um, Later on in private practice, I could know something was coming up and I could schedule that day off. And so my colleagues covered for me and then I covered for them when they had an event. And you can do so much more. And today, I think the call schedule for young residents and interns is much better. I think women probably actually do have a maternity leave now, something that didn't exist when I had my baby in medical school. Um, Fortunately, he was born during a research month when I was supposed to be doing research. And so I researched what it was like to be a new mother that month. But we got through it. And I think it is easier today. There's people are a little bit more understanding, and more than 50%, I think, of medical students today are women. Whereas when I was in school, it was more like 4%. So things are a lot more normal. They're a lot more normal, and that's a good thing.
Wow.
Doctors shouldn't be so tired from being up for 24 hours and then working the next day that they can barely think. That's how mistakes happen.
Right.
And yes, and they have realized that now. And there's a lot of more strategies in place to help the student that's trying to learn and to protect the patient.
Well, since we're talking about it, do you have some advice for young women who want to become mothers and doctors?
Well, my advice, every situation is different. And I would not go into it thinking that all these accommodations are going to be made for me like they would be maybe in another type of job. You still have to get through the training. You still have to remember that if you take off or aren't there, you're part of a team and that affects the rest of the team. And you have to take that whole team into consideration. But you can plan, I think maybe you can plan to have your children, maybe between medical school and internship or residency, maybe take a little time off where you're not inconveniencing someone else and can totally devote yourself to that baby, to bond with that baby. There's all kinds of things that can be designed. Or you might be the kind of person that can multitask very well and have that village around you. You may have your own mother that's close by that can help out, or you have a very helping husband, or you have the means to bring someone in to care for your child so you don't have to drop them off at daycare. It's not always that convenient if you have to be at work at 7 and you might be working overnight to have a daycare situation, as you can imagine. In my life, we ended up relying on au pairs. We had au pairs from Europe, these wonderful young women that were about 18, 19 years old that lived in our home. And so you got to know them as a member of the family and trusted them, and your child could stay home. And it was like their big sister that they loved, that they get up and play with. And you didn't have to wake them up to get them dressed and drop them off somewhere on your way out. You could kiss them in their crib and leave, and knew that you had that comfort that they were being in their own home and being well taken care of. Some people have families. I mean, it just all depends on your situation, but it's all possible. And I truly believed that even though I only had one child, even though I wasn't there as much as a woman that dedicated herself to being a stay-at-home mom, my child sensed emotionally that I was happy, that I was fulfilled in doing what I was doing. So I was a happier mother. And when I was with him, our time was so much more special than if that was something I think I did every day. We had this day when he was a little bit older, first grade. I was out in private practice, and we all worked in my group 4 days a week because there was 1 week out of the month that we were on call for the hospital for 7 days, 24 hours a day. And I wasn't seen around home much that week. But because we worked so hard that 1 week, we gave ourselves a day off every week, and covered for each other in our clinical practice. So that I told my son was his day, that he could pick whatever he wanted to do that day, that was his day. I'd take him to school, I'd pick him up, and he would get to tell me what he and his mommy were going to do. Well, this little boy wanted a golden retriever more than anything in the world. And we had an Irish setter. So, no, we're not going to get another dog. Picked him up one day after school. And he said, well, mommy, this is my day. And here's the newspaper. I circled an ad. There's golden retriever puppies for sale. And I said, no, 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 no. We've had this discussion. He says, but this is my day. He said, even if you don't get me a puppy, you have to take me to look at them. So who can resist a golden retriever puppy? Who can do that? So I knew enough to take my checkbook. And this little guy knew how to manipulate me. He had me wrapped around his fingers so much. So we went, and the whole time on the way there, I'm not getting a puppy, Rory. My son's name is Rory. Not getting a puppy. I know, Mom. I know, Mom. One puppy left, and her name was Rory, short for Aurora. Well, what could I do? What could I do? We went home with the golden retriever puppy. And that was the beginning of our golden retriever saga, because we had had a golden retriever in our family ever since the puppy grew up and died, and another one and another one. And my son, to this day, he's got his third golden retriever, Charlie. And we're just golden retriever lovers. So, but we had wonderful times the days I was with him. And I remember, and I don't know if I put this in my book, but I love to tell this story. I might have put it in my book. I did. I asked him, he's in his 30s, now if he thought he missed anything, because I was in training when he was a little boy and I worked so hard. And I remember as a little boy, he used to say, I'm never going to be a doctor. I said, why? He said, because I don't want to work as hard as you do. But I asked him a few times if he felt he missed anything. He said, are you kidding, Mom? I had a wonderful childhood. I really did. I'm the one that missed. I missed things, but he really, I think, did have a wonderful childhood. So I'm happy to say that, looking back and telling mothers, you can do it. It's hard, but you can do it.
Sounds like being intentional about raising your children is really what you did, raising your son, and that maybe that's the takeaway from this: be intentional and adapt.
Yes, exactly. And I think they learn to adapt. They learn to adapt, and children learn more by example than what you tell them. And he saw that time with family was special and to be cherished, and we made the most of it. And he was resilient. He had au pairs, and he was an athlete. So when he got older, he'd be after school and practices, and all the time every season was a different sport, and he was part of the team. And he was a very empathetic little boy that was always saving animals and trying to save his friends. He'd bring this boy home and that boy home. He said, he hurt his arm. He did this. I want you to fix it, Mom. And so he was just a wonderful life. And I have wonderful memories. Some are painful. When I couldn't attend something, it hurt me more than it hurt him, especially when he was a little boy and he was in preschool, and there would be a Halloween party. No, Halloween parade. And I wanted so much to be able to be there and see him. And of course, his father could take off and be there. So someone was there, but you couldn't do it all. And it was just the way it was. He would accompany me sometimes if my husband wasn't home and I was on call for the hospital, and hoping that I would be home with him that day, but I'd get called in to do a consult. And, I couldn't just conjure up a babysitter. I took him with me. And so typically when you were called in, it was to evaluate a patient in the ER. And all the ER physicians knew him. And they'd set him up in the ER doctor's lounge with cartoons, and they had coloring books for him. And they'd all come in and entertain him and talk to him. And he had a wonderful time. So he just got to know the hospital, the cafeteria. He just knew that he'd be there for a few hours, and then Mommy would take him home. And in the meantime, he'd be entertained by all the pretty nurses. He loved the pretty nurses.
What a life.
What a life. What a life.
Well, you did write in the book that neurology wasn't your first choice. What changed that made you choose neurology over every other specialty?
It was love at first sight, I'd have to say. I was actually a practicing optometrist when I applied to medical school. And I wanted to do more. I liked more of the disease model as opposed to the vision model, and thought it would be really interesting to treat ophthalmologic diseases and do surgery. And when I got into medical school, although I'd had neuroanatomy in optometry school, that's also a 4-year degree program, I just love neuroanatomy and I loved it so much that I did particularly well in it. But that wasn't enough. When I was in medical school, I had to do a neurology rotation. It was a requirement of a month. And the particular month I did that rotation, one of the most famous neurologists happened to be the attending on service. So he was a fabulous teacher. And I loved every case. I loved his teaching. I was enthralled by it. I went out and bought the neurology textbook and read it from cover to cover that month because I just was fascinated with everything about neurologic disease. And it was almost like I was drawn to it like a magnet. I couldn't imagine after that. And I rotated through surgery and ophthalmology rotations and ophthalmology surgery and cardiology and everything else that we could do. But I just kept coming back to neurology. There wasn't anything I loved as much as that. And I just had to do it. So I just totally changed. And I recall and this is in my book, an experience I had in medical school when I was really hoping. I had a 6-week-old baby at home and I had to go back to do a surgical sub internship right away. And all I wanted to do was be with the baby. And why did I do this? What in the world made me think I could have a baby and be in medical school at the same time? Although he wasn't planned, so it wasn't like I planned to do this. But I had an hour and a half drive to get there because I had to change my schedule around because of the pregnancy. And I had to be there at 6 in the morning. And at the end of the day, it was a long day. This surgical chairman insisted we all stay for chairman's rounds, where I don't think this man had a life, where we would sit there till 8 or 9 in the evening and discuss cases. And then we could go home. And then I had an hour and a half drive to get home. Never saw my baby. So I decided I want him. I couldn't bring myself to leave. I thought somewhere in my subconscious that if I just told him I'm not doing this, that he would dismiss me and say, then you're not going to be in this rotation, which deep down was really what I wanted him to do. I just wanted to be with the baby. So I waltzed into his room, to his office, and this is in my stories, if anybody reads it, but it's a good one. And I said, I have to talk to you. I will be the best medical student you ever had. I'll get all my work done and I'll take call every third night like I'm supposed to because it's a sub internship. But I will not stay for your conferences. He said, what? Like, how dare you? I said, no, I won't stay. I live an hour and a half away. I have a 6-week-old baby at home and I'll never get to see him. And I fully expected him to send me home packing. He said, all right, then I'm going to hold you to that. And so I had to stay. And I did as good as I mean, I worked so hard to do a good job while I was there, but I fully expected to get a failing grade because it was pass, fail, or honors. And at the end of the rotation, he called me in and I was prepared and he gave me high honors. And I was so shocked. I was just completely flabbergasted. And I just looked at him just in shock and he said, you know, you have a surgeon's personality. You are making a big mistake by going into neurology. Because it was just like a surgeon to say, I'm not going to do this, just to tell him what I would and I wouldn't do, which was just something I would never do. I would never go in and tell any professor, any head of department that's just not me. But I wanted him to tell me to go home, send me packing. I don't want to be here. But I stayed and I did well. And that difficult rotation was over. And then the other rotations were closer to home and everything worked out. Everything worked out. But that's what I mean when I talk about a personality, different types of personalities. And I am not a surgeon's personality. For one moment I was. That's a mother fighting to be in two places at one time. I wanted to be there, but I wanted to be at home. And that's where the painful part comes in. You can't do it all. But my son was fine. And that's all that I needed to know.
Who else do you think will benefit from reading this book besides women wanting to become doctors and mothers?
Well, I think some of it is geared towards women, one essay, but um, I think anybody that's a lover of true medical stories, lovers of nonfiction, people that like stories of hope and resilience and courage, inspirational stories, anybody who's ever dealt with any neurologic illness or a caretaker of somebody dealing with neurologic illness, because there's a lot of that in there. There's dementia and Parkinson's and all kinds of things in this. Um, it's a book that would really appeal to people in book clubs because book clubs like to I think read about things that have emotion in them. So it's a good book for a lot of different people. There's something in this book for just about everyone. There's something in this book for just people that are interested in the fascinating field of neurology, what lightning does to the body, how Parkinson's disease affects the body, uh, brain tumors, epilepsy. And I have a few stories in this book that I've been told people that love animals particularly loved because I talk about my golden retriever Prancer, who was a very gifted um, therapy animal that was certified as a therapy animal and worked with by my side with my patients for 14 years. So that's a emotional kind of moving story. So it appeals to people, I think, of all ages. There is quite a bit of death in the story, and I try to make a point in the beginning of my book that it's not all about death, but people do die, and that's part of medicine and it's part of neurology. Um, but I'm hoping that people will come away from it feeling that it's more uplifting than it is sad. But it's sad. It's a book that if you um, like to cry when you read a book, if you like to get caught up in your emotions, some of these stories can really make you cry.
I found that when I was reading it, that they are very emotional stories, but so well written. And I, as a former caregiver, could relate to so many of the stories in there. And what you talk a little bit about caregivers in there, but just about what the patients are going through. I also thought about, because you told this story from beginning to end or throughout your career, that I thought about the medical students and the residents that we encountered throughout the years. And I really think that this is a book that would be good for them to read too.
Yes, I wish I'd had a book like that when I was going through training. Because and what struck me when I look back at my journal was how I felt and what I thought when I was a medical student and I was an intern because I wrote these things down. I'm not doing it now from memory because memory is tainted by your who you are now. But I was able to go back and see who I was then, and it was very, very different. I mean, now I would, of course, in a teaching situation, understand that a instructor is going to talk about a case and talk about the prognosis and the symptoms of a patient's case right in front of them, because that's what you do in a teaching situation. And patients that go into a teaching hospital or a teaching clinic are told that ahead of time. We're going to talk about you in front of you. But as a medical student, uh, watching someone in that situation, as my instructor would talk about his bizarre movements while we watched him walk, and that this is what chorea is, and you need to understand this and where it comes from and what they look like. So when we see it in real life, we can understand it and diagnose it. All I could think about back then was how I would feel if I was that young man who was just about my age at the time. And all I could think about was not his choreiform movements and what was happening in the brain. But all I could think about as the young medical student was, oh, that must be horrible for him. Just have us talk about him while he's displaying his disease right in front of us because he must just be so self-conscious. And so I was able to actually see later in my career how I was feeling at the time. And I think that's very instructive for someone going through it, a medical student or an intern going through it, to realize that these are emotions you have to understand and deal with. And that's what training is all about. Um, there was something in my medical school where at Christmas vacation in our first year, they had us all come in for a workshop. It was required. We couldn't stay home. We didn't have classes, but we had to come in. It was like 5 days of intense movies where they showed us movies of horrible things, of people getting raped and people getting killed and people um, sexual abuse victims and all kinds of things to try to numb us. And I don't know if this was the right thing for them to do, but this is what they did. They said, you have to be able to see these things and not react emotionally because you have to go on to another case right afterwards and another case right afterwards. And you have to effectively deal with these people and not fall apart. So they were trying to um, numb us early in our training. And then we'd watch these movies and we'd have to go out into little groups and talk about it. And I thought that was very interesting. And it sort of prepared me um, until I was a resident. And my third year of residency in neurology, something happened to me and my family, my mother's death, that was a tragedy in so many ways. And here I was, I'd had this training and I was trying really well to compartmentalize. And it just shattered me. I couldn't do it anymore because I was grieving and but yet I had to be there and I had to take care of patients. And it took me many, many, many months to be able to get that ability back. And then you have that ability. And as I mentioned, I use journaling to help cope with, process it. And then much later in my career, I had to deal with the death of my brother from a neurologic illness. And I couldn't be the sister in this situation because it was mishandled in so many ways and so many levels by the treating physicians that I had to kind of take over the neurologic part of that and explain to his family, his immediate family, that he was going to die very quickly because they weren't explaining it. And I had to help them make decisions for withdrawal of care and things. And I had to put myself back in that doctor role to do it. So much so later that I couldn't grieve. I couldn't cry at the funeral. I couldn't cry with them at the wake. I couldn't get out of that. I couldn't switch out of that doctor mode back and forth to doctor, sister, doctor, sister. It wasn't until it was all over and I closed the book on it and flew back home that it hit me. And so it's not an easy thing to switch back and forth. I can definitely tell you that. And there are some physicians that who maybe haven't had those experiences in life or are more closed off that, seem to be a little bit more cold, or there might be the physician you think of that doesn't have a good bedside manner. They're just very good at compartmentalizing because that's how they can deal with it. So we all have our personalities and we all have our past experiences in life. But the personal experiences I had, I think in the end made me perhaps a little bit more compassionate with the families than I would have otherwise been, if that makes sense.
That makes complete sense. You did talk about a time that tempted you to walk away from medicine. What made you stay?
It was my mother's death, just my third week into neurology residency. And here I'd picked a residency where I was dealing with people with strokes, people that had brain bleeds, which is so much of inpatient neurology, which is your residency is geared much more towards inpatient than outpatient for various reasons. But I was dealing every day with patients in a neurologic ICU on ventilators and who'd had strokes. And that's essentially what happened to my mother, and very untimely because of a doctor's mistake of giving her too much, of putting her on a blood thinner, but not watching the blood thinner levels. So she had a massive bleed and dropped her blood pressure and stroked her both sides of her brain to the point that it was not compatible with life. And we just had to wait for her to die. It took a few days. But I knew what mistakes had been made, and that was my mother. Um, and I'd just been with her 2 weeks before, and I had to go back the day after the funeral because I was a resident and I had to be there and I was on call. And I was dealing with other people, older people like my mother, people with strokes that on a ventilator that reminded me of that awful week with my mother. And it just was just, and I was grieving, but I couldn't grieve out loud. I had to function. But I hated it. I just thought I can't deal with a field in medicine where I'm dealing with death and dying because I was grieving and I just said, I can't do this every day. I don't want to do this. And my mind was going through all the changes a brain does with grief, which is kind of like a traumatic, almost like a traumatic brain injury, although it's reversible. You have a hard time with attention. You have a hard time processing information. You're in this almost this fight or flight mode, and it's very, very difficult to attend to something else. So I actually decided at one point during these few months, because I was kind of walking around like I was in a fog, and I thought, this is all death and dying. I whatever made me think I wanted to do neurology. So I actually heard about a new neuro ophthalmology residency that was going to be opening up in the city. And I thought, well, I'm a shoe-in for that. I'm an optometrist before. I could help teach their residents about vision. And, I've got almost a year now of neurology residency behind me. I'll be valuable to them. And they said, yes, come on, we'll take you. And there was a switch that flipped because it was towards the end of that year and I was starting to get better. And I just suddenly, when I realized that I was going to do it, I was going to leave. I was going to leave neurology. I was going to go to this other thing where I wouldn't be dealing with death and dying. A switch just suddenly flipped. And I thought, no, I'm better. And I'm just going to be a better neurologist. I'm going to be better at helping families because I know what it's like to be in this situation. And had I had that ophthalmology opportunity a few months earlier, I would have taken it. But it happened let's, the death happened August 3rd. This was now April. And I was just starting to get to the point where I thought I could do this. I could do this. And I like to tell people now, looking back, I didn't see it at the time. It was almost my mother's gift to me. Not that she died, but that the way she died and when she died, that it made me more compassionate physician. And I thought, in honor of her, I want to help people more than they helped me. And that's what I wanted to do, not do surgeries on eyes. And so I turned it down. But it was a real turning point in my life. I think those first few months, I really wanted to leave medicine entirely, but I couldn't bring myself to. It was like it's this love-hate relationship, and I just needed to get through it. And to be honest, when it was all over, my entire residency was over, 4 years. I really grieved. It was like I almost put it off and stopped crying and learned to get through my days and put it behind me. And then it was like it was all over. It was almost like the floodgates opened 4 years later. And I was a big surprise to me that all of a sudden I was crying all the time. And I'm thinking about my mother like I had not gone through when I should have, because I couldn't. I couldn't take the time. And that's a lesson for people experiencing grief. You have to. You have to experience it. You have to live it. You have to go through it. For some people, it's a few months. For some people, it's a few years, because until you do, it lives inside of you and it causes all kinds of problems. It can cause um, depression. It can cause physical illness. It can cause chronic pain. It causes all kinds of things because the mind and body work together until you process it and get it out. And not everybody can. Some people have to get right back into what they're doing. They might have to take care of a loved one. I have a very poignant story in my book about a woman that it's a story about pseudo dementia, a woman that took care of her young son that became quadriplegic from the neck down. She was his sole caregiver for his young life. And she also helped her husband in his business. And she had 5 other children, and she had to raise them and keep everything normal. She didn't have time to grieve essentially the loss of her son's young life, even though he was still alive, until her husband retired many years later. And someone else she trusted could take care of that boy. And then she completely checked out. She developed something called pseudodementia, which is a manifestation of severe depression that affects the brain in such a way that you appear to be demented. And it can be an extreme form of grief where, the short-term memory part of your brain is affected, and the um, stress response in your brain is affected, which affects your neurotransmitters. And you just, for all practical purposes, look like you have a severe dementia. You're not processing information. You can't remember anything. You're um, just checked out. And this woman was treated like she had dementia, but it turned out that this was a tense grief reaction. And once that was recognized and treated, she eventually got better. So grief is a very important thing that is very under, I think, appreciated, and as the brain disease that it is. And my message to people is you have to process it, and not everybody has time. And you have to try to find a way to give yourself time
Mhm.
if you can. There are situations, as you know, as you well know, where you can't. You're the only person that can do that job, that can take care of the other children in the home, or can take care of that loved one that is dying, or devastated by a devastating neurologic trauma or illness. And in some respects, it falls upon the woman because they tend to be the caregivers. But there are men that are in that situation as well. I talk about a man who whose wife developed Huntington's chorea after they had 3 children, and they didn't know it ran in the family. And not this is a devastating neurodegenerative disease where you develop um, uncontrol of your body movements, but dementia as well, and eventually die, often within about 5 years. And 50% of their children had a risk of developing this. And not only did he have to deal with caring for and losing his wife, but then he had 3 sons that he had to be the sole caretaker for, and all 3 of his sons got this disease. And just boom, 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 one died, one was in a nursing facility, and now the other one had it. And this is a true story of heroism and resilience, because this man and his son were upbeat, and they went and they volunteered at Goodwill and helped take care of poor people, and um, soup kitchens and things like that. They devoted themselves, as devastating as his life was. And now the last son, who knew what was going to happen to him, having watched his older brothers and mother the same disease, they just gave back to other people instead of feeling sorry for themselves and retreating. And so they're the people you learn from.
Mhm.
We can't help what happens to us in life. It's how you deal with it that you can help.
Yep. And I can say from my own experience that having gone through, my husband had dementia and I was his full-time caregiver for the last 12 years of his life, that we didn't want to just exist. We wanted to live. And I know that that helped him live a longer, more fulfilling life because we were positive about the life that we lived as much as we could be, and tried to find joy and just do whatever we could to get out there and spend time with people.
Yes. And I think if you get into the right mindset, and it sounds like you were, it's being present. You can't change the past, and you may not be able to alter the future, but the future isn't here yet. And if you can be present in the moment, you can have joy in life. And I think the therapy dog that worked with me, Prancer, taught me that. She taught me of being present and in the moment. And she was quite something. But I'm a lover of dogs, so I really humanize her a lot. But she was practically human. I called her my humine instead of a canine. But being present, yes, being present is so very important, and it's something we have to learn.
Yes. And that's something that I definitely learned through the life that I lived with my husband. We lived one day at a time, sometimes one moment at a time.
Yes, and it's a incredible lesson to learn, and you've been through a lot, which is why you're so good at what you're doing now.
I
You
want to help people share their stories because our stories are so important. Everybody has a story and every story matters.
absolutely, every story matters, and that's the purpose of my that was the whole purpose of writing my book, is to tell these stories because they matter and they teach us lessons.
I love it. Well, where can people find Whispers of the Mind and what do you hope they take away from reading it?
Well, they can find it in any of their local bookstores. If they're not carrying it, they can order it for you. It's uh, available in Barnes and Noble. It's available through Amazon. I do have a website that lists all the places and links to where you can order it, but you can order it on any of the major sites where you get your books.
Okay. And I'll put the link to your website in the notes. Can you tell us what the website is?
Yes, it's Carolyn Larkin Taylor author.com.
I thoroughly enjoyed reading Whispers of the Mind, and it made me think of some of the doctors who cared so deeply for my husband, and I highly recommend it. I really appreciate you being here to talk about your book, Dr. Taylor.
Thank you so much. It's been my honor, and it's very helpful for me to talk to someone who is one of those people out there that was a caregiver or experienced neurologic illness in some way, because you really have a great understanding of the emotions that go along with neurologic disease. And my book is really about that, the emotions I think that we all go through, the caregiver, the person experiencing the disease, and the doctor
Mhm.
who gets emotionally caught up in these things.
That was actually what really drew me to the book was the emotion of it. And I was surprised to read so much emotion from a doctor, but I loved it. It makes doctors human.
Yes. And that was what another purpose of my book was, to try to humanize medicine,
Mhm.
because I don't think patients often see that side of it.
Thank you for listening. Dr. Taylor will be back another time to talk about Lewy body dementia. Be sure to hit subscribe so you're the first to know when that episode is available. I'll see you next time.